Hello, are you taking your NCLEX soon? Let's watch 6 ABG questions and let's interpret them correctly. So let's start with the first ABG. Okay, so let's look at it together. The ABG of the patient is the following: so pH of 7.5, a PaCO₂ of 30, and a bicarb of 24. What is the acid-base imbalance? I'm going to give you a couple of seconds to kind of determine the acid-base balance here, and we're going to look at it together. Okay. Okay, so the first thing you usually want to do is to know the normal, right? So we have a pH has a normal of 7.35 to 7.45, a PaCO₂ of 45, and then a bicarb of 22 to 26. So when you're taking your NCLEX, you always have this 8 by 11 eraser board so you can write it down so that you don't get confused. So the first thing we need to determine whether the pH is going to the alkalosis side or the alkalotic side. So we know that if it's going higher, it's going to be alkalosis, right? If it's going below, it's going to be acid. And then when it's higher for PaCO₂, it's going to be acid. When it's lower, it's going to be alkalosis, right? And then again here, when it's higher, it's alkalosis, right? And then below would be acid, right? So those are kind of like the things, the guidelines. So let's look at it together, okay? Let's look at our pH. Our pH is 7.5, so that's going to be high. So that would be on the alkalosis side, right? And then if we look at the PaCO₂, it says 30. That gives us an impression. If it's 30, we know it's below 35. It's going to be alkalosis, right? And then, of course, our bicarb is within normal limits, within normal, right? So the final answer, eh, so the final answer is respiratory alkalosis, right? But are we compensating? If you look at the bicarb, it's 24. So it's normal, right? So that tells us that the kidneys have not started compensating yet. So the final correct answer would be uncompensated respiratory alkalosis. So did you got that? Okay, so let's go to the second ABG. So this is our second ABG. A client has the following ABG: pH of 7.20, a PaCO₂ of 25, and a bicarb of 15. What acid-base imbalance is present? Okay, so I'm going to give you a couple of seconds and let's look at it together. Okay, so let's look at it together. Let's start with the pH, right? So our pH is the pH is on the low side. So we're going to consider that as an acidosis, right? And then look at our PaCO₂. The PaCO₂ is on the low side, so that tells us that the lungs is trying to compensate. It's breathing a little faster. So this is going to be your alkalosis part. And of course, your bicarb is on the low side, so we know it's acidosis. So the final correct answer would be metabolic acidosis. Now the question is it uncompensated, partially compensated, or fully compensated? The fact that our PaCO₂ is on the low side, that tells us that the lungs is trying to compensate by breathing a little faster. And since the pH is still abnormal, so the correct answer would be partial compensated metabolic acidosis for question number 2. Okay, so let's go to ABG number 3. Okay, so we have ABG number 3. Our pH is 7.26, a PaCO₂ of 56, and a bicarb of 24. Again, the similar question, what is the acid-base imbalance? Okay, I'll give you a couple of seconds there, and let's start analyzing the pH. Okay, you're done? Okay, so let's start. Let's look at our pH. This is on the low side, right? So now we will consider that as an acidosis. Look at your PaCO₂. It's 55. So it's also on the acidotic side because it's elevated, right? So that's going to be your acidosis, right? That tells us that there is respiratory acidosis here. So the final really is respiratory acidosis. Now the question is, are we compensating or not? Now look at the bicarb. The bicarb is normal, right? Because we have 22 to 26 as our range. So it tells us that the kidneys are not compensating yet. It's not. So the correct answer would be uncompensated respiratory acidosis for our ABG number 3. Okay, so let's do ABG number 4. pH of 7.62, PaCO₂ of 48, and a bicarb of 45. So what is the final ABG interpretation? Let me get my pen. Okay. So let's start with the pH. It's high, right? So we know the pH is high. So this is telling us that there is alkalosis. Okay. The next thing we're going to do is your PaCO₂. Your PaCO₂ is slightly elevated, right? The PaCO₂ is slightly elevated. So this is on the acidosis side. What is telling us that the lungs is trying to compensate by retaining CO2 in the lungs. That's why it's on that elevated side. The bicarb is actually high, and that tells us that there is alkalosis. Now, because pH and bicarb are alkalonic, our answer here would be metabolic alkalosis, right? The question right now, is it compensating, partially compensated, or uncompensated? Look, the fact that the PaCO₂ is around 48, we know that there is partial compensation. So partially compensated metabolic alkalosis for ABG number 4. Okay, so let's go to ABG number 5. So this is our ABG number 5, 7.44, PaCO₂ of 54, and bicarb of 36. Now let's look at what the final ABG is. Okay, I'm gonna wait for a couple of seconds. And then we'll start. Okay, so let's start. So the pH is so it's 7.44. So we're kind of like within the normal range, but leans towards the higher end. That's the reason why we're gonna call this alkalosis, right? Now the bicarb, I'm just gonna look at the bicarb, really, really high, right? This is really high, so we know this is going to be alkalosis when the bicarb is high. Now look at the PaCO₂. That's also elevated, right? This is on the acidosis side. So the fact that you have a pH and bicarb going hand in hand, the final ABG interpretation is going to be metabolic alkalosis, right? Now, this the fact that this PaCO₂ is going up and the pH is actually within the normal range, we're going to have what we call fully compensated metabolic alkalosis for question or ABG number 5. Okay, so let's go to ABG number 6, 7.35, PaCO₂ of 60, and bicarb of 40. So what do you think? Let's look at it together. So let's look at the pH first. pH is 7.35. That pH is actually normal. It's going on the low side, but it's normal, right? So we can categorize, since it's going to the lower side, we can categorize that as acidosis. Look at your PaCO₂. That's elevated. That's going to be acidosis, right? Then look at your bicarb. It's elevated, right? That's alkalosis, right? So the bicarb is so high, and this is why, because the kidneys are compensating by retaining bicarbonate. So since the pH is within normal, so initially our issue here would be respiratory acidosis. And the reason why we say respiratory, because the pH and the bicarb are all the acidic side. Now, because the kidney is retaining a lot of the bicarb, the correct answer would be fully compensated respiratory acidosis. So how many correct answers you got out of 6 ABG? Write that in the comments, and thank you for watching.